On.
Okay, so moving on to pain provocation testing. This next test is called the active straight leg raise test. This test is, it's been proven numerous times to be reliable, sensitive, and specific for diagnosing postpartum pelvic pain, which is in essence SI joint pain. So what you're going to do is you're going to have your patient lying supine. You're going to ask them with a straight leg on the involved side to just raise their foot up 6 inches. Okay, and then you are going to ask about pain reproduction. So if that reproduces pain in their right SI joint, maybe in addition the pubic region, when they raise it about here, that is positive. Okay, that's a positive finding. In addition to getting that positive finding, we're looking at the pelvis as they do this. This test shows us about their ability to have that perfect form and force closure throughout that pelvic ring. So in a dysfunctional situation, you're going to see pelvic rotation, possibly extension, basically excessive movement through the pelvis as they raise. When you see that, or if they have pain, you're going to come in and you're going to perform compression to the pelvis. Now go ahead and raise again. What you would expect is for that pain to significantly decrease in the SI joint when you're performing that compression. So a true positive is pain with the leg raise, decrease of pain with the leg raise while they're being compressed. Another little additional thing you can do is ask them to recruit their abdominals. So just teach them, I just want you to kind of bring your belly button to your spine and ask if that changes their pain as well. It's a good teachable moment of how important it's going to be for you to train those muscles to help hold the pelvis stable. All right, the next set is a clinical prediction rule, okay? So it shows you on there the sensitivity and specificity for this clinical prediction rule. So I'm going to kind of breeze through all of them very quickly. The distraction test, basically you're going to cross your arms across the patient's pelvis on the inside of bilateral ASIS, and then you're just going to push apart, okay? Basically you're compressing the SI joint. And you're asking, does this reproduce pain? The next one on your test, go ahead and lie on your side.
Does it matter which side?
Yes, it must be on the side that they are complaining of pain. Okay, this is all to try to reproduce their concordant sign, which with the SI joint is going to be pain in the SI joint, maybe an additional pubic pain as well. Next one on your list is the compression test. Painful side up. You are going to provide kind of an anterior force on that ilium. As you do that, basically you're going to be stretching the ligaments on this ipsilateral SI joint, and that should reproduce pain as well. So you're going to push straight down through the anterior aspect of that ilium, and you're going to be asking about pain reproduction on this side.
So that's the compression test that distracts the SI joint.
Correct. The tests are named for what the therapist is doing, not for what is actually occurring at the SI joint. All right, lie on your stomach, please. The next test is called the sacral spring. So you are just going to push a downward force on the sacrum, much like a P to A that we've taught you in the lumbar spine. Okay, so you're going to get over that sacrum, and you're just going to provide about 6 thrusts straight down through that sacrum, and you're asking about pain reproduction. Okay, again, that should be that unilateral pain response from that sacral thrust. Supine. Next one on your list is the thigh thrust. I am going to put my hand under the sacrum. I am then going to flex the hip and slightly adduct. Then I will perform an axial load through that femur. Essentially, if this is the femur and this is the sacrum, again, I'm stretching that SI joint and seeing if that reproduces their pain. Scoot toward me, please. All right, so I'm going to come up. I'm going to kind of roll him a little bit to the side so I can get my hand under sacrum, bring him back over. I hug that femur into my chest, adduct slightly, and then I sink down. And that is providing that stress to his left SI joint. I can feel with my hand that movement.